I'm going to bring up our first guest speaker, Nicole Stallworth from the Children's Center.
Good morning, good morning. Seemed like you could hear this microphone a lot better from over there. How's everyone? Good. We're gonna, my style is that I like to have a little bit more of an interactive conversation, and so please bear with me if I may throw a question out there. I really don't, my style isn't to talk at people, but rather to engage you in the conversation. So my name is Nicole Stallworth. I'm the Director of Community Outreach and Government Affairs at the Children's Center. I've actually been with the Children's Center now for about 6 months, 6, 7, 8, 9 months, something along those lines. And it's been an incredibly busy time for us at the Children's Center. I came onto the Children's Center because I'm very passionate about children's issues. I really have begun to establish myself as a child advocate. My background prior to the Children's Center is that I was the director of grassroots advocacy for, interestingly, the Charter Schools Association in the state of Michigan. And what I did for them was really did a lot of research, groundwork on parental education, education reform, and how that affected children in the K-12 education system. And what I quickly understood was that there were a number of disparities that were affecting our children throughout the state of Michigan. And it's because resources are just not there anymore to be able to provide the necessary and adequate services that children need. And I kind of made it my issue to ensure that children within the K-12 system get the services that they absolutely need in order to be successful in life. So that's a little bit about me. I am also a mother of one, Tony Wells. She is a senior going into her senior year at Renaissance High School this year. So we're gonna have a fun year. I'll let you know. I'll let you know how it goes as we progress throughout. But she's a good kid. She's working at the DMC right now in their Project Genesis in the Nursing Administration Department, doing administrative work. So she gets to learn a little bit more about healthcare. Moving on, I want to tell you a little bit about the Children's Center and what we do and the kinds of services that we provide to children and families throughout the county of Wayne. How many of you are actually familiar with the Children's Center? Just crickets.
Yeah, crickets.
Okay, the Children's Center is a behavioral health and child wellness organization that actually was founded back in 1929. And what we do is we specialize in providing therapeutic support services to children and their families, dealing with behavior, emotional, intellectual, and developmental issues. We also work with children in foster care. We license foster care homes. We recruit those homes. We train them to place children who've been removed from their homes due to abuse or neglect. We have more than 200 expert staff, including myself, although I'm not a psychiatrist, a psychologist, clinical therapist, caseworkers, and administrative support to be able to provide for the needs of the young people that we come in contact with on an everyday basis. Everyone is pretty much very passionate about children. If you were ever to enter into the Children's Center to come along for a visit, you'll find that most of us are very, very passionate and caring about the children that we care for. Our philosophy is that all children deserve a healthy start in a nurturing home and a safe environment. That is very critical as we start to hear about the conversations about early childhood education, early childhood. It's very, very important that children, as they begin to develop in their formative years, have the right foundation to be successful. All children and their families should be treated with honesty, integrity, and respect. All families have strengths and capabilities that should be maximized in developing services that are focused on solutions that are centered on family and appropriate for the child. How many times do we hear that something is wrong with you? Well, not necessarily. That's not what we believe. We believe that every family is different and unique. Their needs are unique as well as their children's needs are unique, and we want to make sure that we're supportive to that. In the city of Detroit, we had a little less than 25,000 children that were in families that were investigated for abuse or neglect. So it doesn't mean necessarily that it was a proven case. However, it says that there was some suspicion of something going on here. 3,500 of those were confirmed victims, which is about 14% of all investigations. And what we find from there is about little more than 2,000 of those are living in out-of-home care. Doesn't necessarily mean that they're in the foster care system, but the majority of them are. Some of them are living with relatives. Michigan relies heavily on relative care for children who are not currently living in their home situation. In Wayne County, the numbers are there as well for children who have been removed. And it's a little bit higher for Wayne County. It's about 15% of all investigated abuse or neglect cases actually translate into children living outside of their home. So that's about 67% of all children who have been confirmed as abuse or neglect cases are actually living outside of their home environment. I want you guys to understand what that means for a child having to live outside of their home environment. It's very, very traumatic. There's data that suggests that children who have to be removed from their home actually go back 4 grades intellectually because it affects them that much. They're unable to really cope. Sometimes it's very difficult to transition into living amongst strangers, if you could imagine for yourself. Me personally, not my thing. However, this is what some of our children are subjected to, okay? Abuse or neglect. Again, this is the kids count data. African Americans represent about 29% of confirmed victims, which is roughly double their proportion in the state's total child population. Well, you ask, why is that? CPS suggests that there is some racial bias at key decision points, and a state task force has been assembled to implement strategies to address the issue. However, that is the information. There are higher incidents of such factors like poverty, teen parenthood, neighborhoods with more contact with law enforcement, maybe some reasons why we see more African American children represented in that number of high-risk factors. Additional information that I wanted to share with you. One of the things that really interests me a lot is the issue of child welfare as it relates to mental health for children. I talked about the trauma that children endure based on being moved around from house to house, but there are other socioeconomic, environmental factors that create stress in children's lives, and it affects their ability to think clearly, and we call it mental health. 1 out of every 5 children has a diagnosable mental illness or a behavioral disorder, but 70% of those children do not get treatment. Depression, intellectual disabilities. We're seeing more and more children with autism cases. Many of those children, because they don't have access to health care, they don't understand what the issues are, they don't understand how to recognize symptoms of mental health, they don't get treated for these issues. 1 in 88 children are diagnosed with autism spectrum disorder each year. And there are more births to teenagers in Metro Detroit than any Tri-County area. The Children's Center, however, is in a position to help. This is the work that we do. We work with that population that I just outlined for you. We provide more than 20 strength-based programs that are family-focused and recovery-oriented. They fall in about 4 major categories of services, which is we work with children to provide them with that healthy start from ages 0 to 6. We also work with children who have been traumatized or are experiencing those behavioral health issues that I talked about before. We provide foster care to children who, foster care placements for children who've been removed from their homes due to abuse or neglect. And we also provide all kinds of advocacy services. We link them to tutorial programs. We provide their families with the necessary economic supports as much as we possibly can to provide a support system for these families. Oftentimes what happens with children who may be diagnosed with some behavioral health issue, children who are in foster care, it's a strain upon the family. Not only is it a financial strain, many times children who have some type of behavioral health issue or diagnosis, one parent is not able to work oftentimes because they have to be home caring for that child. Oftentimes with the children that are in the foster care system, the state stipend doesn't really provide a huge amount of dollars to be able to support this family. We're talking about $5,000 per year roughly per child. So a little bit about our initiatives, and I'm going to close it up really quickly here and ask for questions. One of the things that we're doing, I told you before that I was very passionate about K-12 education. One of the things that we're really trying to do is make sure that children who are in the K-12 system have increased access to care, that there's an increased awareness of behavioral health symptoms and services available. What happens oftentimes is that I talked a little bit about children being criminalized for their behavior. Oftentimes, if they've not been diagnosed properly, they are dismissed as a behavioral problem within the classroom setting and in the school setting. Oftentimes, they're expelled from school, and I know Mr. White talked a little bit about the criminal justice system. We know data suggests that children who spend less time in school are more than likely to become incarcerated, and this is an initiative to really try to decrease those risks. Engage parents and educate them on behavioral health issues so that they are not afraid or don't feel uncomfortable reaching out and getting the services that they need for their children, which will hopefully increase the likelihood of student success in the academic setting. One of the important factors that I want everyone to also leave here being aware of is that we have a growing number of children who are aging out of the foster care system. Many children who have been in foster care, the older that they become, the more difficult it is to place them. And it's for reasons that people are just not sure about having an older child in their home. They're not certain what they may behave like. I told you about the trauma that these young people endure. What essentially ends up happening is people become afraid of their behavior patterns. And so it becomes more and more difficult to place them. So once they age out, they can start aging out of the system at age 16, and they can decide for themselves that they no longer want to be adopted or placed in a foster care home. They can be placed in a host home setting. And we have a program called Young Adults Self-Sufficiency Program, which actually trains these young people on how to live on their own. We keep them all the way up until age 21 due to the recent legislation that passed that allows children to age out of the foster care from age 20 until age 21. They receive a stipend. They receive life skills training. They're required to be in school full-time and work part-time or full-time, their choice. And we also try to provide them with all kinds of resources to make sure that they can be as successful as possible. The respite program, again, is just another additional resource to be able to provide resources to families who have children that are in foster care and they may need a break from those services. And so some of the initiatives that we're currently working on relative to foster care is partnering with the community to ensure that we wrap our own arms around this issue. We talk about children being very important to us. And I know my child is very important to me, but so is yours. And so is the next man's child and any other child who really does not have a voice. And so I personally am leading this initiative to ensure that we're not segregating ourselves from our children who don't have a permanent home situation currently. What I'd like to see happen is orientations throughout the community is what we're working on. We're working on engaging for support services for families who do have children in their home in foster care, providing awareness and education on the realities of foster care so that people understand that, you know, it might be okay to get a child who's 14 in your home as long as you have the necessary resources available to support you. So with that said, thank you everyone.